Your pain doesn't start in your neck. It's in your shoulder blade, your arm, couple fingers that won't stop tingling, so you almost didn't think to blame your neck at all. But a pinched nerve in the neck is one of the great impersonators. It sends its symptoms somewhere else and lets that body part take the blame. The medical name is cervical radiculopathy. And once you understand the patterns, a lot of confusing arm and hand symptoms suddenly start to make sense. That's what this video is about. What a pinched nerve in the neck actually feels like, nerve by nerve. I'm Dr. Omar Ramos. I'm a fellowship-trained spine surgeon. In the next few minutes, I'll walk you through how a pinched nerve in the neck shows up, where the pain goes, where the numbness lands, which muscles can get weak. I'll go nerve by nerve because each level in the neck tends to leave a different fingerprint. But I want to be clear up front. These patterns can overlap, and no single one of them is a diagnosis. I'll show you why that matters as we go. And near the end, there's one set of symptoms that means this is no longer a simple pinched nerve. It's the sign that the problem may have moved from the nerve root to the spinal cord itself. I'll tell you exactly what to watch for. Let's start with the basics. Quick foundation. In case this is the first thing you're watching on it, your spinal cord runs down through your neck. At each level, a pair of nerve roots branch off and head towards your arms. Each of those roots exits through a small bony opening called a foramen. A pinched nerve happens when something narrows that space and irritates or compresses the nerve root. Most commonly, that happens from a disc herniation or from bone and arthritic changes that crowd the opening over time. Here's the part that confuses almost everyone. That nerve does not stay local. Each root talks to a different region of skin and different set of muscles down the arm. That's called a dermatome. So when that root gets irritated, the symptoms light up wherever that nerve travels, which can be inches or feet away from the actual problem. That's why the pain can be in your hand while the problem is in your neck. And it's why the location of your symptoms is a clue to which nerve might be involved. Let me show you the map one level at a time. Let's start near the top of the practical range, the C5 nerve. Think of C5 as the shoulder and outer upper arm pattern. This is the one that can be mistaken for a shoulder problem. The pain or numbness tends to sit over the shoulder and the outside of the upper arm. Usually it does not travel all the way down into the hand. The last part matters. If someone has mostly shoulder and upper arm symptoms without much hand numbness, C5 is one nerve I think about. But the shoulder itself also has to stay on the list. The muscle pattern is also important. C5 is the nerve that helps power the deltoid, which is the muscle that lifts your arm to the side. It also contributes to the biceps. So C5 weakness can show up as trouble raising the arm away from the body. On exam, the biceps reflex can sometimes be affected, although reflex patterns overlap and have to be interpreted in context. So the C5 fingerprint is shoulder and outer arm pain, possible weakness lifting the arm out to the side, and usually not much hand involvement. Now, if C5 is more shoulder and upper arm, C6 is the thumb side pattern. This is one of the patterns spine clinicians see commonly, so it's worth knowing well. The classic complaint is pain that runs from the neck or shoulder blade down the arm and towards the thumb side. The sensory pattern often follows the thumb side of the forearm and into the thumb and index finger. When someone tells me my thumb is numb, C6 moves higher on the list. The muscle pattern includes the biceps, bending the elbow, and the wrist extensors, the muscle that lift the wrist and hand up. So C6 weakness can show up as a weaker biceps or trouble holding the wrist up. The reflex most often associated with C6 is the brachioradialis reflex, and the biceps can be involved as well. So the C6 fingerprint is pain or numbness towards the thumb side, symptoms into the thumb or index finger, and possible weakness bending the elbow or lifting the wrist. If C6 is the thumb side pattern, C7 is often the back of the arm and middle finger pattern. C7 is also a very common and recognizable pattern. The classic complaint is pain running down the back of the arm and forearm, sometimes into the middle finger. The sensory pattern often points towards the middle finger region. The muscle pattern centers on the triceps, the muscle that straightens your elbow. It can also involve some of the muscles that help flex the wrist. So C7 weakness can show up as difficulty straightening the arm against resistance, or a sense that pushing motions have lost power. Things like push-ups, pushing yourself up from a chair, pressing something away from your body. Those movements may feel weaker. The reflex that can be affected is the tricep reflex. So the C7 fingerprint is back of the arm pain, numbness towards the middle finger, and weakness strengthening the elbow or pushing. Patients sometimes describe it as a dead arm feeling when they push or reach. C8 is where the story starts to overlap heavily with hand and elbow nerve problems. That's why this level can be especially confusing. The classic complaint is symptoms along the small finger side of the hand. The sensory pattern often involves the ring finger, the small finger, and the inner edge of the forearm. The muscle pattern involves many of the small muscles of the hand, the ones that help you with grip and fine finger movement. So, C8 problems can show up as a weaker grip, hand fatigue, or clumsiness with fine tasks. Things like opening jars, holding tools, typing, using buttons. C8 does not have a simple, reliable reflex the way some of the other levels do. So, we lean more on the sensory pattern, the motor exam, and whether the MRI fits. The complication is that C8 symptoms can look a lot like cubital tunnel syndrome, where the ulnar nerve is irritated on the inside of the elbow. Both can involve the ring and small finger side of the hand. So this is one of the situations where a nerve study like an EMG can sometimes earn its place. So the C8 fingerprint is ring and small finger symptoms, grip or fine motor changes, and a lot of overlap with nerve problems at the elbow or the wrist. Now, this is the most important thing I'll say in the whole video, so don't skip it. Everything I just gave you is the textbook map. Real people don't always read the textbook. Nerve patterns can overlap, and they do so many times. One person's C6 looks exactly like the book, another person's C6 spills into the territory the book assigns to C7. Some people have anatomy that's wired a little differently. Some have more than one nerve involved at once. So if your thumb is numb, that does not mean you've diagnosed yourself with a C6 radiculopathy. It means thumb side numbness is a clue that points towards a region, and a clue is the beginning of an evaluation, not the end of one. That map helps, but the diagnosis comes from matching the map to the exam and the MRI. Your symptoms, your strength, your reflexes, your imaging, they all have to tell the same story. Hold on to that. It's the difference between recognizing a pattern and diagnosing yourself. Let's leave the map for a second and talk about how this actually feels to live with, because the patterns on paper don't capture the experience. Most people describe the pain as sharp, burning, shooting, or electric, not just the dull ache of a muscle strain. It can shoot down the arm in a way that's hard to ignore. Numbness and tingling often come and go. Many people also notice the arm symptoms are worse than the neck itself. Sometimes there's barely any neck pain at all. Sleep is where a lot of people struggle. Certain positions can set it off. People end up shifting all night, looking for one position that doesn't light up the arm. Then there's the neck position relationship. Many people find that certain positions make it worse, such as looking up, turning, or tilting towards the painful side. Some people also discover the opposite, that resting the hand on top of the head actually eases the arm pain. That relief with the hand overhead pattern is one some patients with cervical radiculopathy notice, and it can be a recognizable clue. If any of this sounds like your daily experience, you're in the right place. But stay with me, because the next part is the one you do not want to miss. Here's the set of symptoms I promised you at the start. Everything so far has been about a nerve root, a single nerve, usually one arm. Pain, numbness, or weakness that follows that nerve path. But that same neck that holds those nerves also holds the spinal cord. And when the problem shifts from the root to the cord, the whole picture changes. That condition is called cervical myelopathy. Its warning signs are different from a typical pinched nerve. Hand clumsiness, fumbling when trying to do buttons on a shirt, dropping things, handwriting changing, balance problems, feeling unsteady on your feet, symptoms affecting both sides of the body, arm symptoms combined with balance or leg changes, a heavy, stiff feeling in the legs that doesn't fit a simple arm nerve story. A pinched nerve tends to be one arm following one nerve's path. Cord involvement tends to be broader, both hands, the legs, balance, coordination as well. If that broader pattern sounds familiar, don't treat it like a routine neck pain. That is a reason to be evaluated promptly. Not because every person with those symptoms automatically needs surgery that day, but because spinal cord compression with symptoms is a different category of a problem. The timing and decision making can be much different. There will be a dedicated video on cervical myelopathy in this series. What it is, why it matters, and why timing can change the conversation. If those broader symptoms ring true for you, that is the one to watch next. One more thing you need, because this is where a lot of people get scared unnecessarily or falsely reassured. If you get a cervical MRI, there is a very good chance it shows something. These bulges and arthritis are extremely common, especially past a certain age, and plenty of them cause no symptoms at all. So a finding on the report is not automatically your answer. The finding only matters when it lines up with everything else. When the nerve the MRI says is compressed is the same nerve your symptoms and your exam are already pointing to. Thumb side numbness, a weaker biceps, and C6 compression on the MRI, that's three things telling the same story. That's a stronger diagnosis. Thumb side numbness with an MRI that shows compression somewhere unrelated, that's a finding that doesn't fit. And chasing a finding that doesn't fit can send everybody down the wrong road. That's why reading the report is its own skill. And there will be a separate video walking through exactly how to read a cervical MRI report without scaring yourself. That video pairs directly with this one. So here's what a pinched nerve in the neck really is. It's a nerve root irritated where it exits the spine, sending symptoms down the path it was always meant to serve. That's why pain can land in your shoulder blade, your thumb, your middle finger, while the actual problem sits in your neck. Each level tends to leave a different fingerprint. C5 around the shoulder and outer arm, C6 into the thumb side, C7 down the back of the arm towards the middle finger, C8 along the ring and small finger side with grip or fine motor changes, but the fingerprints can overlap. None of them is a diagnosis on its own. The answer comes from matching the pattern to your exam and your imaging, all three telling the same story. And if your symptoms are broader than one arm, both hands, the legs, balance, coordination, that's a signal to move faster and look for prompt evaluation. This video is not here to diagnose you. It's here to help you recognize the pattern so you can ask sharper questions when you're evaluated. I'm Dr. Omar Ramos. Thanks for watching. I'll see you on the next one.